What nonsense is this? Rubbish people. How can I receive such an amount of money?
How much did you get?
£200.
Let me see what you got. Oops. See what I got. I just received £200 from my brother.
Oh, you got a lot more than I do.
Oh yes, with MoneyFix, you can receive money from any part of the world to Cameroon directly into your mobile money account at the cheapest rate.
Wow. Are you looking for the best exchange rate for all your money transfer? Try MoneyFix. Log on to moneyfix.com. MoneyFix. Fast, easy, and cheap service to Cameroon. MoneyFix.
September is around the corner, and there is no better time to embark on your journey for studies in the UK than now. Are you looking for an opportunity to study in the UK? Do you want to graduate as a critical thinker and to gain the skills employers are looking for? Do you want to study a course in the shortage occupation list of the UK? Would you like to gain work experience by taking advantage of a 2-year post-study work visa? Would you like to study a science, technology, engineering, and mathematics degree to enable easy access to a permanent residence after graduation? FK Global Education Ventures got you covered. FK Global Educational Ventures will primarily evaluate, assess, and advise you on the necessary requirements of admission, assist you in choosing from over 300 courses, assist you gain admission into any university of your choice, helps you with your visa applications, assist you with accommodation, airport pickups, and settling in the UK. For more information, do contact us on the details you see on your screens. Thank you and God bless.
One of the things that make me feel very beautiful and very confident as a brown skinned woman is choosing the right skincare products. So here guys, I feel of the products that I use that make me feel very beautiful, very confident. And if you have any skin issue, be it acne, hyperpigmentation, or oily skin, dry skin, whatever problem it is you're facing with your skin, trust me, Escape is here for you. Escape is actually formulated to suit all skin types, all melanated skin types. So when you use this, you see how confident I'm feeling. This is going to be you after using Escape products. Trust me.
Hi, ladies and gentlemen. How are we? Happy Sunday, happy Father's Day, and happy everything that you hold dear today. It's your girl, Deli Singer. I'm here today to be talking about health, okay, with our very own doctor. But before we bring her on stage, I would love for you guys to pump us hearts like we do. Share the video, guys. Thank you so much. Thank you. I'm exhausted, guys. If you can see that through my glasses, I'm so exhausted. Happy Father's Day, every father on Deli's matchups. I wanted to say Deli TV. Yes, Deli TV as well. Hi, Jay Martins. I see you, Papa. Happy Father's Day to you. Happy Father's Day to one of the youngest billionaires in Cameroon. Okay, that's Jay Martins Akpo. Okay. Happy Father's Day to every one of you listening to me. Happy Father's Day to all the fathers on Deli's matchups. Happy Father's Day to all the daddies, those who are present in their kids' life, most especially. Happy Father's Day. Happy Father's Day to those of you, to be fathers, okay? Happy Father's Day to single moms who are playing that role as well. Happy Father's Day to us all. I love you from my heart. Okay, so today, without further ado, I'm not going to be long on nitty-gritty on things that are not relevant. Okay, so let me just get to the chase. I see a lot of you. Let me know where you're watching from. We have a doctor in the house. You want to share the video. I understand that this is a very tricky topic. It's a very what word, sensitive? What do I use? So it's not so many people who are bold and confident enough to talk about health things, okay? But it affects us all. I am not a medical expert, and I'm just here to ask questions to the doctors, and I'm going to relay your questions to the doctor, okay? Just so that you know, whatever questions you have in your heart, ask. So you can ask for a friend, ask for a neighbor, ask for some other person if you're shy. But this is the plug. This is where you come and ask for genuine, because when you come with medical help needed on the platform, I don't know anything. Like I said, I always just leave it for you people to do whatever you want to do. But she is a medical practitioner. She's a medical doctor. And who else could tell us more about STDs? In fact, everything regarding our health, our health in general. Okay. So I'll be bringing her on stage. But guys, share the video. I'm not seeing too many hearts. I'm not seeing too many people tuning. I'm not seeing too many of you. Okay. So share the video. Tag your friends, okay? Those who are sick, those who are not sick, you could use this for the knowledge you're going to gain today for tomorrow. You never can tell. You could be sick tomorrow, okay? Yeah. Jay Martins is telling me that he found a wife. I know you're still a chronic bachelor, so don't even be deceived, girls. Chinda Naterila, I see you. Dilisinga, I see you. Dialect Daku, I see you. Our audio, I see you. I'm seeing strange names today. It's just too many people added. Okay, so these are people who are interested in Health Watch. Really? Okay, it's great. See Sylvie Mundi, hi. Nkoke Pupe, hi. Chinda Nateria, seeing you already. Akumbom Fidelis, hi. B Evodia, hi. Hi to you all. Asom Cecile, hi. Jay Martin's in the building. Make some noise. Hi, Ebane Karin. Esther Raul, I've seen you. Happy Sunday to you. Happy Father's Day to all of you. Happy. Thank you, guys. So it's a beautiful smile, my pop jaw. When I smile small, so all my jaw didn't come on. Thank you, guys. Thank you. Can you guys kindly share the video, okay? Share to different groups. Pump hearts, okay? Our beautiful doctor. It's a beautiful thing. I love to see women doctors. I always, because it looks like it's a man's thingy. But when I see those women who have done 7 years, my goodness, and then they went in for if they want to be experts in that field, they take another, I think, 3 years or 5 more years. So these people have learned, they've studied. So you want to respect them. That's why I respect medical doctors. My kid sister is there. She'll tell you that my daddy wanted me to be a medical doctor, but I was too much. And as time goes on, I know that I wasn't called for anything orderly, anything that is so orderly. No be my calling. Okay, guys. Okay, I see you all. I see you. Now we've just started, and somebody is coming that they need help. Okay. I thought it's the you want to send your So please, I need help. I don't sleep once it's 1 a.m. to 5 p.m. Oh, I'm always choked up. Okay. The doctor is here, okay? She's behind the screen. She's going to come on. Dr. Christabel, if you're there, can you make your way into the studio, okay? Because the questions are already coming. I hope that you've shared the video before you get into the studio, because you cannot share after you've gotten in, just so we know that. So if you want to get out of it and share the video and then you come in, then it's going to be fine. Guys, pump us hearts while she prepares to come on our screens, okay? We're going to be talking about STDs. Let me put it on there, just so we know. I don't want us to deviate and start talking about other things. I understand that when you see a doctor, everybody just wants to, but for us to make it orderly, we're making this thing topical. So our doctor will be here every Sunday, hopefully. If she's not there, I'll let you guys know in advance. Okay, so this is something we're just trying to see if it's going to work like that. But hey, like I said, it's a topical show, so we are coming today with our topic, how to prevent and manage STDs, okay? Just so we know that every one of you on the internet is supposed to be watching this. You're supposed to be here, because somehow we just pick up these diseases like that. Somehow we don't know how we contract them. Sometimes we contract them, we don't know how to go about it. And for with my understanding and my experience on this platform, Africans especially don't like, they don't like hospitals. You don't want to go to the hospital. So you always want to come and ask, oh, they should tell you this. It's either a change of lifestyle you want, or you just want the traditional one. But hi, this is our doctor. So she's going to take us through the medical route and, if possible, tell us exactly what kind of lifestyle changes we should be having, okay, to make every change or get the cure that we need. Okay, guys. So keep pumping hearts and share the video, share and share and share. I'm not very impressed with the number of people who are watching. I know you guys are shy, but for how long? Why would you be shy when we all can relate with the topic? Because even when I put up the flyer, you guys were saying you're shy to share. To share STDs, it doesn't change anything. Share. Even like I said, if you have to ask a question for your neighbor, go ahead and ask. Okay. So Shanslin Nyanga, I love that name, Nyanga. I see you, darling. Sylvie Anye, I see you, sweetheart. Dilisinga, I see you. Bonsoir, bonsoir. Those of you who are French, Dr. Christabel can articulate in French as well, because she's based in Yaoundé at the moment. So, yes, so many doctors are online watching. It's interesting, right? And I'm happy that they would give their inputs as well. So thank you, guys. Without further ado, ladies and gentlemen, join me. Welcome our doctor, Dr. Washi Christabel. Ta-da-da-da-da, ta-da-da. Pump hearts, enough hearts for our doctor, guys. Pump her heart. Hi, doctor, welcome.
Hello, everybody. Hello to everyone on this platform. I'm also a member of the platform, so I'm welcoming myself too.
I know we have all manner of persons on here, so you had to come up with yourself. I mean, it's good to have you. It's good to have you. Welcome to the show. I hope that your network is going to permit us do this, because we have to do it. Okay. Yeah, so I'm not going to be projecting comments now. Doc, if you can hear me, I know that the network in Cameroon, it could be crazy, okay? So whenever you disconnect, just try reconnecting again, okay? We're going to have this show. It's a lot of persons who are on here already waiting for you to come and answer to their many questions, okay? Hi, for those of you, palm hearts now, palm hearts for Doctor. Doctor is here already. The network is messing, but it's okay. Palm her hearts. Okay, and encourage her as she comes and joins us again. So, doctor, if you can hear me, just come back, use the same link, get into the studio, and I'm gonna put you on the screen again. Yes, I see your comments. Okay, I see them. Yeah, you all. Yes. Share the video. Doctor, you have your so many accolades here. You have your so many salutations, so you want to come back and get them. Network in Cameroon. I start kabash for that network for Yaoundé, because I don't get it. I don't get it. Cameroon, no, Cameroon. When I started protest there, on our network providers them up their game. Okay. So, doctor, can you hear me? Can you connect again? Let's have a talk on this. So, on today's episode is the first of its kind, and it's beautiful. I'm excited because I want to learn as well. I'm just here to transmit your questions to her. We will be looking at what STDs are. We will be looking at she will talk on how long after exposure before you get tested. Okay, so if you have had sexually transmissible, any sexually transmissible disease, or you've had unprotected sex with somebody and you're not sure, how long would it take for you to be tested, or when does it for it to show, for your results to show? I think she's back in there. We will be talking about the different reasons why some diseases reoccur. So you have chlamydia, for instance, you have hepatitis B, you have whatever, gonorrhea. Then after a while, you think you've treated all of that. After a while, it resurfaces like that. Then we're looking at a different treatment. So this is all of what we'll be talking about. Doctor, I think you're there. Let me add you on screen. Can you hear us, Doc? You're on screen now. Hi, Doc. Welcome back. Oh boy. Hello, Doc. Can you hear me? She's gone again, guys. And you have to be patient, okay? This network is a liar. We'll have this show by fire by force.
Oh,
I
I
know,
pray
I
please,
know.
you guys.
It's so frustrating. I know,
It's
right?
frustrating. I don't know why it's just today. Let's just go quickly, please.
Yeah, so you want to
Exactly.
just introduce yourself, where you from, who you are, what you do, and then we can take it from there. Yeah.
Okay. So I'm Dr. Ngwashi Christabel, medical doctor practicing in Yaoundé, Cameroon. I'm originally from the Northwest region, Bambili to be precise, Bambili village to be precise. And I'm also a health communicator because I found out that there's a lot of health literacy in the community. So I started using social media, radio, to start sending out accurate health information. Because as you see, when lots of people ask medical questions here, you get all sorts of responses that you even leave confused. So that's one of the things that I discovered. So I
Sometimes
said,
I really feel terrible for you, sitting on the platform and seeing the quacks, quote unquote, that are there and giving all of those.
yeah,
How do you feel? Do you feel neglected? Do you feel how do you feel
uh,
about it as a medical doctor and having people who have not studied like you, who don't know what they're saying, giving information like they are the doctors themselves? How do you feel about that?
I feel well, it's a mixed feeling because the problem is I can't really blame some people because it gets really frustrating when you have health problems and you're going to the hospital, which is supposed to be your place of refuge, and you're not getting the solutions that you want. So it becomes
I
frustrating
know.
if you tend to get information from anybody. You just want to be healed. But on the other hand, I also feel bad because you know where to get information from. If you go to one hospital and it's not working, you have the right to seek a second opinion from another professional, or you see a specialist. Don't just jump into saying that, okay, white man medicine doesn't work, please, traditional medicine. So sometimes it's just a mix.
Oh my God, it's getting interesting, right? That your network should
Yeah,
just
it's a
respect
mix.
itself here.
I
All right,
pray,
Doc.
I pray so.
All right. I'm really happy that
Oh,
it's a blessed platform that we have all manner of persons on here. Like I said, I'm not a medical expert. Matter of fact, I don't know anything about it. I wish I were a medical doctor because I love that part, that route. But clearly, God didn't call me to be a medical doctor because I'm way too scattered to be a medical doctor. Okay. But like I was saying earlier
right.
on, bless his soul, my daddy, he wanted me to be a medical doctor and I had to study sciences like that. But
Mhm.
I thought I would have been an excellent art student because that's where I think I read, that's where my niche is coming from. So I
Okay.
respect doctors for the length of time that you people put into in your work. I respect you people for the privacies that you have to keep. I respect you for
Mhm.
the all manner of things you see. And you
I
sometimes I ask you, do you people
know.
eat? How do you eat after coming out of touching all of those things?
Ah, yeah, you have to eat. If not, you don't have hunger. So sometimes you just have to separate yourself. Like, okay, it's just this. It's my job. Once I'm home, I have to eat. So that times you're eating, you're in a surgery, you finish, you come and eat, you go back. So we try. As you say, God is giving us the grace. So we thank
Amen,
Him.
amen. I'm really, really happy, and I like to see. It's a tough one, and when you see a woman, especially because you need to have big brains. When I see a medical doctor, it is tantamount to an intelligent person because you have to have those A grades like that. And before you get into Qs, before you get to
Right.
any specialty, do all of those things. So I salute you, salute every medical practitioner only here listening to me. Man, you guys, 37 gun salute to you people. It's not an easy thing. Okay, so let's get to the chase, doc. Today we'll be talking about STDs, mode of transmission, what they're all about, how to treat them, why the reoccurrence when you think you
Mhm.
have somehow you're done with treatment and then it's showing up again. Guys,
Yeah.
before the doctor starts talking, okay, you want to pump hearts. Everybody from the northwest and southwest, you're watching me pump hearts. From the rest of Cameroon, Pom Hearts. From Northwest region, Pom Hearts. Bambili, Pom Hearts. You see your medical doctor on screen. Begin to Pom Hearts. It's not easy. Do you know what it means to have 5 advanced level papers with 5 A grades? Do you know what it means? You should just form hearts because of that. Just be sharing and sharing and pumping hearts. I mean, it's such an honor, Doc. I'm so happy. Like I said, the platform, we're blessed to have all manner of persons on the platform: doctors, medical doctors, we have legal practitioners, we have all manner of persons. Okay, so we have pastors, we have all sorts of
It's my pleasure, actually. It's
oops
my pleasure.
network too. Right. So it's an
Yeah.
avalanche of all of walks of life. Okay. So we're happy to have all of you. I guess we'll also have a slot for legal cases too. Okay. So we're having a slot for legal
Of
cases,
course.
and we need a lawyer to come and talk to us about these things. Okay, somebody is saying art students'
Right.
lives matter.
We
For
need
those of you art students, you people should not be jealous. Say hi to all the science students. Today we are celebrating science students. Art students should just pack. People should just pack one side with literature. Pack one side today. Today is biology, chemistry, further maths, further mathematics. And before we get into that, guess what? Somebody said, I don't know who actually came out with further maths. That maths the first strong so people they never finish find X. Some person go
Then
add
you
further
go
maths.
again for that again.
Oh my God, it's good to have you guys. Welcome once again, Doc. Welcome. So let's start with STDs. So can
Thank
you
you.
tell us, break it down, what STDs are all about? Tell us what STDs are. Yes, art students, before her network comes back to its senses. Okay,
Yeah.
let's have STDs. Let's have you pump more hearts for her. So Doc, are you there?
Yeah, I'm there.
Yes, so
You
let's
need to
start with
know really
defining
like
properly. I know, don't worry. Just when you, like I said, when you disconnect, just connect again.
the
So, what are STDs? What are they? Define them, breaking down the best way possible. Just break it down for us. What are STDs? Can you hear me? What are STDs? What are STDs? Can you hear me? Can you hear me? Oh boy. Hi, doctor. Can you hear me? Oh boy. Okay. Right. That's it. Maybe when she comes there, she's going eventually. Yeah. So just go on. What are STDs?
So STDs are sexually transmitted diseases. Some people can call it sexually transmitted infection. There are a number of them. Of course, there are diseases that are transmitted sexually. So it can either be the only route through which that disease is transmitted, or it could be one of the many routes. Because you
Okay.
see, something like HIV, sex through sex is just one of the modes of transmission. Meanwhile, it has other modes of transmission. STDs, you have a number of them. You have syphilis, you have the most common people know syphilis, chlamydia, gonorrhea, you have HIV/AIDS, you have herpes infection. That herpes could be
Herpes.
oral
Yeah,
or
we call it
genital.
herpes.
Like
Yeah.
I saw somebody
Yeah.
ask a question one day on the platform about,
Yeah.
like somebody asked a question one time about please, what is the treatment of herpes? Herpes can either be oral, affecting the mouth, or it can be genital, affecting the private
Okay.
organ. So you need to be specific what kind of herpes you're talking about. Then you can also have hepatitis B and
Talk
C,
about that.
which can
See,
be
yeah,
transmitted.
wait, before you go
Okay.
ahead. This particular hepatitis B, I think we're going to have another session altogether to talk about hepatitis B, because based on empirical data, it like say all man for Cameroon get hepatitis B. It's everybody, quote unquote, coming on to ask about hepatitis B. And doing my own small research, I realized that it is so common, much more even common and deadlier than, of course, you are the medical doctor here. You're going to be telling us how bad that is. I am certain a lot of persons on here want to hear about hepatitis B. But hey, let's just focus, okay, and get on. When Doc comes back again, she's going to be talking on all of that. So now I say native doctor, they don't want me to spoil their you guys are crazy. Okay, guys, just wait, okay? Just hang on. She will be back in less than no time.
Oh.
I'm using now your computer, okay?
Yes. So I'm trying to see.
Okay. Can you hear me, Doc? Okay. See, when you connect, you're there. Can you hear me?
MTN
Can you
is
hear
going
me?
to disgrace me today.
No, it's not going to disgrace you. Don't worry. We can hear you. It's never going to disgrace you. Disgrace is not your portion. So don't worry yourself. Everybody understands how crazy this network can be in Yaoundé, okay? If you can hear me, can you hear me? Guys, palm heart now because now palm heart now. Why that way, doctor? The internet is spoiled too. Now wait till now palm heart share video. Okay, guys, she's back. Okay, don't worry. Okay, we understand. We understand. It's not the first time I've had guests come on the show and it's crazy like that. So don't worry.
Yeah. I mean,
See, you are the doctor. Would you respect doctor then? Oh, she don't fear with you if you got disconnect. So don't worry yourself. It is not your fault. Say Duala on wash. That's the next. Is it a general problem or it's just Yaoundé or it's just her phone or her network? Okay, guess what? So yeah, go ahead. Just keep talking. Just keep talking. Let's hear the lecture.
okay. So yes, we're saying you have syphilis, HIV, gonorrhea, you have trichomoniasis. It's a vaginal infection, and then
I
you
bet
have
sugar. Should call that name say sugar. Say trichomoniasis. You know how many people they know trichomoniasis? Okay, yeah, doc. Sorry, I was just teasing you.
Yeah. So you have all of those infections. The most common that people know: syphilis, gonorrhea.
Oh boy.
I'm telling you, this is annoying. I don't know. My internet has been fine the whole day. I don't know what's happening now.
Don't worry. Like I said, just go on. When you connect and when you reconnect, just go on. Just go on talking. I said trichomoniasis. As you're asking the native name, it means sugar. Most girls, in fact, 9 out of 10 girls, 9.5 out of 10 girls would have experienced that, especially given our setup in Cameroon like that.
Yeah.
Yes, Doc, go ahead.
Okay. So somebody is asking, how can I know that I have it? So generally, you could either have symptoms or you don't have symptoms. Most of these sexually transmitted diseases, they could be asymptomatic for a long time. Let's take, for example, syphilis. The incubation of syphilis is like from 2 months to about 20 years, depending on the type. So you could be infected with syphilis and then it's showing the symptoms like after 20 years. So it could either be
2 months, 2 months. Guys.
Okay. So when you have symptoms, generally, it's usually, sorry?
2 months to 20 years for an incubation period of a disease.
Syphilis, yes, it's about 3 weeks. 3 weeks to 20 years, depending on the type of syphilis. Yes. So you have some of them that the incubation period is really long and they will not show you any symptoms. So if you have if you want to know how it shows, but when it shows symptoms, generally most of them they're going to show with you have bumps around your genital area. It could be itchy. Like women are going to have vaginal itches, men are going to have like scrotal itches. That's itches around their penis and their scrotum. You could have some rashes as well. You could have some discharge from the penis or from the vagina, a discharge which is not normal because for women they normally have a vaginal discharge. So if you have a discharge that is abnormal and it's malodorous, that means it smells bad, which you're not comfortable with. It could be a sign of a sexually transmitted infection. Also, you could have pain during sex or during urination. if you have pain during sex or during urination, it could be pointing towards a sexually transmitted disease, a sexually transmitted disease. So that's just the general symptoms, but each of them have specific symptoms that it could present with. Like HIV. HIV could just show with fever that doesn't go down with other medications that are given in the hospital. You just keep having fever, keep losing weight and all of that. Then you go to the hospital to do the HIV screening and it's positive. So each of them have their specific symptoms. And based on Delhi's recommendations, so let's zoom in today on HIV, chlamydia, and you said syphilis, or was it gonorrhea?
Hepatitis B.
So
But
let's
you know
zoom
what?
in on
Let's
HIV.
leave hepatitis B. See, I want us to take our time and really talk about our hepatitis B, except you're going to talk on it passively, okay? But hepatitis B looks like it's something, it's really a canker worm self, no, it's an understatement. So I need us to really talk about that. But you know what? Today is just the first. And I would love for us to touch on all of this because we're talking about STDs. So it's the angro like that. So let's talk about the different types and just do a vivid explanation on maybe all of that or all of them. How long after exposure before you get tested, generally speaking?
Yeah, and just like one of the questions somebody asked, like how do I know I'm infected? So there is a time between when you are infected and when you start showing symptoms or when it tests positive in the test. Please give me a minute and put on the lights.
Okay. Pump hearts, guys. Share the video, okay? Pump more hearts and share the video so that to encourage the doctor now. Doctor is here. Science students in the building, make some noise. Art students, when I just hold on, okay? I'll get on a lawyer, make and talk for one too. But today it's science winning. So you guys should keep jealousy aside and watch this video.
So you have what we call the incubation period. You have what you call an incubation period for the different sexually transmitted disease. So you say you cannot get exposed. Let's say you have unprotected sex with somebody you suspect today, and then tomorrow you're going to the hospital to do a checkup. Most of the tests are going to be negative, but that doesn't mean that you're declared negative or you're declared safe, because you could still have been infected, but the test is showing negative just because that infection has not passed its incubation period. Okay, so for something like
not cutting you, or let me cut you on there. I beg, I don't tell you to the breakdown the term them for this one gone them for platform here. Maybe they will not understand all those your medical jargons like that. Incubation period, you and I understand that, but you want to break that down again? Yes.
Okay. So what I'm saying is there's a period between when you get infected and when the test shows positive. And that period is called an incubation period. Okay. That period differs for different diseases. Like, for example, chlamydia. Chlamydia is about 7 to 21 days. So you see that even if you get infected with chlamydia today, you go and do the test tomorrow, the test is going to show negative. But that doesn't mean that you have not been infected with chlamydia. Okay? So there's a certain amount of time that you should give. There's a certain amount of time you should give before you go for testing, and that is the incubation period. So for chlamydia, it's about 7 to 21 days. For HIV, it's about 2 to 4 weeks. But also you can do it after, like, when we do it, we give another period of 3 months to actually show that you are negative, because sometimes HIV, it could have a period where it doesn't show negative, or it doesn't show positive on the strip when you do the test. And then for syphilis, so for syphilis, it's about 3 weeks to 20 years, as I was saying, depending on the type of syphilis. So you can have a boyfriend or somebody you had sex with.
I saw so at the year. So somebody could have syphilis 20 years. It inside, even first before the signs start showing. Someone I know. So those of you who want to go and be toying without rubber, they talk the thing enough. So since we don't want to hear say anything they like say they prevent sick the time. Stop spoil skin. Una no one year. Use rubber. Una no one year. Prevent una no the year. Now doctor, this don't come here. We can't explain it in the
Yeah. So that's why when I see patients, I said, okay, you have a sexually transmitted disease, they start blaming their partners. Like, no, that means that my man give me, oh, now my woman give me. No, sometimes it takes that time. It could be maybe an ex-boyfriend, it could be an ex-husband, it could be an ex-partner who got you infected, and then it is just showing at that time. Okay. So for gonorrhea, it's about 1 to 14 days. And for herpes, it's about 2 to 12 days. I know you may not cram all of these days, but it's just for you to know that there's a period you have to give before you test positive. Okay, so even if you go and test negative, there's a time that your doctor will give you to come back and do a retest to actually declare whether you're negative or positive. So
and in that window
period,
sorry, doc, and in that window period, you as the person can transmit the disease to another person, can you?
Definitely, yes, you
When I
can.
don't hear no. So no, she don't say that period. So na time for go to all. I don't tell her. I do not to all. I did do and so. Anyways, I would hide ID every second. So wait, doctor,
I
my
know,
doctor already
right?
hide ID. So this question is coming from
Okay.
Jay Martins. I saw your question. It's an interesting one. It's a good question. I can't find the question again. I'm not sure why. Okay, question. That's it. That's his question. So Jay Martin is asking, can I get an STD if I'm a virgin?
Okay, it depends on your definition of virginity, because there are a lot of people that have redefined virgin. So if your virgin means that
Virginity
no
now.
penetration,
Virginity don't get different definition. Do not generation.
yes, yes, because some people do oral sex. You have oral sex, but since they've not had penetrative sex, they think that they are virgins. Okay. Meanwhile, some of these STDs can be transmitted orally. You understand? Like herpes. Herpes can be transmitted orally. Hepatitis can be transmitted orally. So some people, when you mean virgin, does it mean that no penetrative sex, or what kind of sex? Because some people have had oral sex but no penetrative sex, and they consider themselves virgins. So
some people are secondary virgins, though, just so that we.
So I want to know first, what is your definition of virginity?
Overall, or generally speaking,
that is another one. Some people are repentant virgins. That's another case. So that's what I'm saying. It depends on your definition of virginity.
Okay, guys. Hey, when I laugh with you say secondary virgin, I've been a secondary virgin before I'm married to. I know you. One I laugh. It's crazy. It's a crazy comment section on you.
Jay Martins, if you mean that, if your virginity means no penetrative sex, no oral sex, no sex toys, nothing of that sort, no, you can't get it. But if you have, it depends on the type of STD, because I told you that some of those diseases like HIV, you can get HIV from even blood transfusion. You can get HIV from sharing blade and all of that. So that some of this.
I'm happy you mentioned that. Okay, that particular HIV thing. What percentage of persons really get HIV through all these stereotypes? Based on the fact that, I mean, you would better educate me on this, because I understand that the HIV virus is that fragile, especially when it's exposed. So what percentage would you really say that people could get it? Because all man now, so when you get HIV or any other, must be a true sex. Must be a true sex. What percentage can we really have HIV through the other means, not sexually transmitted?
Okay, presently the most way of transmission is through sexual intercourse. The most common mode of transmission is through sexual intercourse in our setting, followed by mother-child transmission, because you can have a pregnant mother who is not following her treatment well, she can transmit it to the child. And then you have also blood transfusion, because you have, sometimes we test blood for HIV and all of that, but some people have had HIV from blood transfusions. So generally you have all of these other methods that could also act as a mode of transmission of HIV.
Okay. Now, Jay Martins has asked another question again, but I would love to let's just stay on HIV for a bit. This for kids, okay, who are infected, how long can they survive with HIV? Is it possible to have kids who are born with it
Sorry?
and is it possible to have kids, like kids born with HIV and they survive, like if they placed on medication, kids, not adults? Did you hear my question?
No, please repeat it.
So we talked about mother to child transmission, which is the second most common means of transmitting
Mhm,
HIV. Is
mhm.
it possible for that baby that is infected to actually survive, like if it's placed on medication?
Yes, it can. We have a lot of babies surviving. A lot
Okay.
of them. Yes, because immediately the child is born, even to an exposed mother, even though the child has not been tested positive, we just start
Mhm.
immediately on antiretrovirals until the child is retested after 6 weeks to see if the child is positive or negative.
Oh, okay.
So
So
we
with the
actually take those
antiretroviral,
precautions.
it serves like a preventive
Yeah, yeah.
mode. Yeah. Okay. I
Mhm,
I get it.
mhm.
I get it.
Yeah.
So for those of you listening, so you can understand that, okay, so that you don't no go assume say okay begin to already be infected so oh now one die or you one die because most people
Mhm.
have this mindset like that. So
Yeah.
they take these preventive measures and then yeah, you want to answer the question on the screen. If you have any more questions, you
Okay.
can ask, drop in the
Are
comments.
condoms effective against all STDs? Not all. As I said, some of them can be transmitted through oral sex. Okay, so you can have a condom on, but if you have like oral sex and you have, say, a wound in your mouth, you can get, and your partner is, say, HIV positive, and let's say, okay, let me take for example, you have a girlfriend or a wife who is HIV positive and she has a wound in her mouth, and then you have, say, a wound on your penis, and she gives you a blowjob. Both you can get infected. Okay, she
Una the year no. As soon as work pupu una mob for plenty places so. Then the one talk una say una no know sabi una come out sick. Na thing and that gigi una sick them. Since una don't work as a size, una one chop different thing the way pass the trouble una mami give una. Doctor is coming back. Okay, pump more heart, share the video. Okay, it's gonna be an interesting session because I know that, like I said, everybody is related. This topic affects each and every one of us. If you're not sick, you should have a family member who is sick. If you don't have a family member who is sick, a friend should be sick, or just use this for posterity. These things you could use them. Okay, knowledge is never wasted like that. Okay, so keep asking your questions and dropping them
yeah.
in the comments. So yeah, so they've heard that okay, you can have
So
them. You can
as
wear a
I was
condom on and
saying,
still have diseases.
condoms are not effective against condoms are mostly condoms are mostly condoms mostly prevent those that are transmitted through penetrative sex. Okay, through penetrative sex, that's through the penis to the vagina directly. And as I said, you have some of these diseases that have shared modes of transmission. So if you don't get it through sex, you can get it through other methods. So condoms are going to prevent you from those diseases that are solely transmitted through penetrative sex. For example, syphilis, chlamydia, gonorrhea. Those are the ones that it could prevent you. But things like HIV, hepatitis, herpes, that can be transmitted through other routes like oral, shared blades, shared blood, and all of that. You could actually you can get it from those other methods.
Okay, doc. And still on
Mhm.
HIV, before we maybe if we have time, we can get on other stuff. So this HIV,
Okay.
when they come on here, it's a lot of I don't know people or persons coming privately to tell me, oh, they can treat HIV and all of that. They want to go through. It's not the conventional giving the antiretroviral drugs like that. They have
Yeah.
modes of treatment. What
Mhm.
can you advise the audience listening on these different people who claim to be treating on that? And have you at any point in all your medical works have have you had anybody who has been tested positive and come back negative like that, and claims that okay, it's because of maybe these other routes that they tried and it worked for them?
Okay. The thing is, I'm a medical doctor, okay? So I'm not going to deny that I'm not going to deny the power of traditional medicine or herb or natural herbs. I don't want to say traditional. I wouldn't deny the power of natural herbs, because I think that if we do proper experiment, if we do proper research, we are going to see a lot of healing abilities of these medicinal plants we have around. Even the Chinese, they're using medicinal plants for different ailments. So I'm not going to deny the power of that. But I am a scientist. So if you don't show me research, if you don't show me scientific proof that this thing works, it's hard for me to believe. And also, drugs have a process through which they are manufactured. That's why you're going to hear, drug control trials. You're going to see drug control trials and all of that. They're doing trials to see. And also, when you buy a drug, you remove that paper inside, you see the amount of information in it, right? Whenever you buy a drug and you check that paper inside, there's always a paper inside.
Yes.
So that paper is it's knowledge from the level of research that has been done for that particular
And that's what I'm saying. They don't read it. We don't. Yes.
So it involves the safety profiles. It involves the side effects. It involves the dosing. I've had patients that have come back and told me, doctor, I read the paper and the dose shows that this dose was too much for this child. And I said, oh, sorry, my pardon. Because some people go in there and have been able to save themselves just by reading that paper. So when you come with a traditional, so when you come with a natural treatment that doesn't have any of those studies, you don't tell me about the dosing, you don't tell me about the side effects, you don't tell me about the pharmacokinetics. That's how it is being excreted by the kidneys. Because there's a dose at which these drugs that the whites make, they tell you, okay, at this dose, it is being excreted at the kidneys at this dose. If somebody has a kidney problem, give it at this dose, so that you know how it is safe for the patient. Because all drugs, be it Western drugs or traditional drugs, are unsafe for anybody. Okay, so when they bring those medicinal plants that don't have all of those things, it makes me to wonder about the safety, not like the efficacy. It could be effective, but I'm just bothered about the safety and what is the active ingredient, what is the amount of active ingredient, what is the preservation that has been used for it, and all of those things inside. Yeah, because I've also seen patients who have taken these medicinal plants and they're coming back with kidney failure, with liver failure, and all of that. So that is the problem we have. It's not like we're fighting medicinal plants or natural treatment. No, it's just because there's a process through which a drug prescription takes. Some people might use it works fine. I'm going to your second question about having somebody who has done that. There is something about the viral load, okay?
I was coming to that, but I think it works for you to just say it like, we just go ahead and say that. I was about to come to the viral load. Okay. Like, what is it about it? Because there's a lot of persons who ask that question on the platform about the viral load, about their CD4 count. I don't know, all those your jargons like that. Maybe you want to shed more light on that. Yeah, sorry. Go ahead. Thank you so much, J. Martin Akko. I see you. Before the doctor comes back on screen, I see your questions, okay? So don't worry. When she takes up on the question. Yes, Doc. You can just go ahead. I was talking to somebody in the comments. So, share the video, guys.
Talking about the viral load. So when I'm talking about the viral load is the amount of the HIV virus inside a certain quantity of blood. Okay. So if you take your HIV medications well, you follow your treatment, you follow your rendezvous, you follow your appointment with your doctor, your viral load can drop to a level that is no longer detectable in blood, to an undetectable level. And at that level, you cannot transmit it to somebody else. That's why we advise that we have discordant couples. One is positive, you have the husband may be positive, the wife is negative, and the wife never gets to have it.
Infected,
yeah. He never gets infected because the partner is taking their drugs well, they're following their treatment, they're living a healthy lifestyle. because you should not put out lifestyle out of it. They are living a healthy lifestyle, and so they don't get to transmit it to their partner. So sometimes
At
you
that
can
point,
have
Doc, at that point, are they advised to stop or to continue with their antiretroviral drugs?
you have to continue because it's the antiretroviral keeping it down. So if you stop it, the next thing is it's going to multiply and then it goes back up. So
Does that
you have
again?
that's when you actually have to be very cautious and continue your treatment, continue your lifestyle modifications, and continue your treatment well.
Does that work with any level of the viral load, or it is just when it's at the early stage that could actually be kept at the low? Or even if somebody has gotten to a particular level or stage in that of that ailment or disease, you can still, as long as you are very meticulous, is it, with taking your treatment, it's going to drop down. I don't know if you understand the question. Is there a Are you there? Oh, she's frozen. Guys, share the video, okay? She's definitely going to come back, as you know, okay? When she comes back, she will take all of your questions. So, Doc, did you get my question?
No.
So the viral load, right? Which you mentioned that, oh, at some point it's going to show like, oh, it's not really traceable like that. I was asking, is it for everybody or just for some level, like maybe those who just contracted the disease and they are very there's a different word I want to use.
Early in the disease.
Sorry.
When
Yeah,
you've
the
just
sorry.
early stages.
Early
No,
stages.
no. At any stage that you're being diagnosed, if you take your treatment well, it could be reduced. Because there's a problem, there's a difference. Because we also should note the difference between HIV and AIDS.
That was one of the questions that was asked. I think let me just project it. So maybe you want to just answer the question. So
Okay.
I think it's going to get. Do you have symptoms?
Okay.
No. Jay Martins, thank you so much, Papa. You have very orderly questions. And I think you're speaking for the majority of the persons on there. So that's why I'm projecting your questions. So yeah. Mm-hmm. Yes,
so
Doc.
HIV and AIDS, let me say there's a difference between HIV and AIDS. You can be HIV infected, but you don't have AIDS. Because HIV infection has different stages, according to WHO, according to the World Health Organization. You can have HIV stage 1, HIV stage 2, HIV stage 3, then you have full-blown AIDS. Okay?
Yeah.
So it's that particular symptoms and particular characteristics that actually qualify you to say that you have AIDS. I don't know if you understand. So somebody who has tested positive is HIV positive. That means the person is infected with the virus, HIV positive. Now, it's when if somebody is HIV positive and the person doesn't take the treatment well or doesn't follow the treatment well, the HIV can progress to AIDS.
Yes.
Yeah. So that's it. That's the difference between HIV and AIDS. Not everybody with HIV has AIDS.
Definitely.
Because some of them have HIV, they take their treatment well, their viral loads become undetectable, they are fine, they are even healthier, they look healthier than both of us, and all of that, they don't have AIDS. But you have people who are HIV positive that progress to have AIDS.
Okay, so that coming back to my question, so I was asking. So we now know the difference. So you said HIV stage 1 or stage 2, stage 3, and all of that. So if you take for whatever stage it is, as long as it is still HIV, you can drop your viral load to undetectable. Is that it? Una the year inside the comment. Una the year to they talk because when I don't want to take medicine, una the only one can find na people the way they don't make the one. I do belong to that same school of thought, like the doctor said. The obviously the people who have come out with I think I believe in traditional medication as well. Yeah. But you see with HIV, it's a lot of persons who have died because they have left their antiretroviral drugs and they're chasing very unconventional means and all of those quacks out there thinking they want to clear their system and all of that, whereas and unknown to you could actually just be very, very faithful with taking your medication and your viral load goes to that level undetectable, like the doctor mentioned. I'm happy. I've always known that, but I'm just happy that she Welcome back, Doc. Right. Okay, I'm just happy that she reiterated on that. So, Doc, did you get the final bit of my question? Can you hear me? Can you hear me, Doc? Okay, so that's it, guys. So if you're listening, at whatever stage you are, like she said, so some people are when I don't go rest, you see place where this so when I don't go rest. It's a lot of young people dying. Before we got to bring this, I'd send me a doctor come on the platform and come and start educating you people. I'd had it up to here. Like everybody is sick in Cameroon. You cannot trust anybody. You can't. Like I always say, everybody is HIV positive until proven otherwise. In fact, you are STDs positive until proven otherwise. That's how I deal with people. And if you have that mindset with me, okay, doctor has come. Let me not give my own layman doctor's lectures here. So, Doc, did you get the last bit of my question?
No.
So I was asking. So these
Please, I
different
really apologize for the internet. It's not one
Oh,
on like
yeah,
this.
don't worry. You are a medical student. Anything you do and today correct. Even internet as we go up to a correct. No worry. So what I was saying is that the different stages, like you mentioned, as the HIV stage 1, stage 2, and stage whatever, as long as it is not graduated to A, and you are faithful with taking your medication the way the doctor has prescribed it, your viral load is going to drop and drop and keep dropping and dropping like that.
The viral load will drop, and as the viral load is dropping, your CD4 count is increasing. CD4 count it's like increasing. The white blood cells that fight infection. So what happens is when you're infected with HIV first of all attacks those cells, and then they start dropping. So when you take your treatment well, those cells start increasing, and it also it boosts your immune system. When those cells are increasing like that, it boosts your immune system, and you're able to fight the infection better. Yes.
So at that stage, are we supposed to? Is it just okay? So you said it's a life. We cannot overlook the lifestyle bit of it.
Yeah.
Like okay, so apart from taking your antiretroviral drugs, your lifestyle, your habits as well would matter. So if you care, you go begin the to offer all side to all the say you take antiretroviral drugs. That one. As you do one thing with this side, the counter and with the other, your lifestyle, because that's.
I forgot to add, there are different strains. You have HIV-1, you have HIV-2. So you could be infected with HIV-1, you'll take your antiretroviral, and then you go have unprotected sex with someone who maybe has another strain, and you get infected with it. It complicates the whole thing. So that's another issue. So people can be thinking like, I'm taking my drugs, I have undetectable viral load and all of that. And then you go somewhere else and get another strain which complicates the whole thing. So if you're taking your treatment and you're already seeing progress and you're already getting better and all of that, the most important thing for you is just to practice fidelity. It's just to practice fidelity.
Because you could go and worsen your situation. Some of you are stage 1, when are better, you are better. So don't just kill yourself, because this is the thing. When they just test positive, it is either the end of the world or they get into depression and all of that. So you could even be at a level, at a stage, you're better off than another person.
Yeah,
so don't know that.
HIV complications are a lot. If you have HIV and you don't have complications, you are on a good side, because you have complications. You have people, it goes to the brain, people, it goes to the heart, people, it goes to the kidneys. So you have people who have lots of complications, a lot of complications. So if you're one of those who is taking your drugs and you don't have complications, you are way off better, because with your antiretroviral and your lifestyle changes, you're going to be fine.
So the guys, have you heard? Somebody translators, the doctor, they talk about English, somebody break and down when I go pitching. You know me say when you get HIV, maybe you just work at all. You still deal a person where it prevent another HIV. Today I've learned a new thing. So John will say there's a better level of HIV, quote unquote. There's a better level of it. So if you have the stage 1, stage whatever, you're still better, because even if it's the stage 1000, you're still better than somebody who is still at the 8th level. Because at that point in time, Doc, just let's stay on the. Is it possible for somebody who has gone to the eighth level to be for that situation to be reversed? Ever possible? Maybe better lifestyle choices, maybe the retroviral again, steadily and consistently. Is it ever possible? Did you get my
Okay.
question?
No.
Okay. I'll take it again. I don't tell you so if you're science student, so everything works for you today. So
I really apologize.
come on. Is it ever possible for somebody who is AIDS, okay, an AIDS patient, for that situation to be reversed? Better lifestyle choices, consistency with antiretroviral drugs at that point in time for that situation to be reversed to maybe a lower level of HIV. Okay. Dr. Emo, answer the particular question. So that more, yeah, fine. Yes, guys. So share the video, Palm Hearts, okay? She's obviously gonna connect back, okay? Share, and share again. Tag your friends, tag all your friends. Whether they be HIV positive, they don't know. You don't know people their results. They need to come and learn from here. I'm tired of all the medical whatever you people give on the platform, and it's not working, and people are just dying
Please,
every day.
can you
People are
repeat the question?
definitely. So I was saying that, is it possible for somebody who has been diagnosed AIDS as an AIDS patient, for the situation to be reversed, for so more like you can have more better lifestyle choices and be consistent with your antiretroviral drugs, for that situation to be reversed onto the level of HIV, just HIV? Is it ever possible?
Once you've already had those characteristics that qualify you to have AIDS, you have AIDS. Okay, as I said, AIDS is a stage of the HIV infection. So once you're already at that stage, we cannot say that you're cured from the AIDS, because you could get better. Your viral load could get better. Okay, your viral load could get better. Your viral load could go lower. Your CD4 counts can increase. You can eat well, feed well, exercise, and you look good. But that doesn't mean that you still, or how will I put it? You already had a diagnosis of AIDS, but I wouldn't say that you are cured of the AIDS, okay? Because you still have the HIV infection, but you can live a better life. You could get better and you can live a better life. Like you can live from the AIDS stage and go back to maybe stage 3 or stage 2 or stage 1.
How many different stages are there? We have 3 different stages, do we, before you get into the eighth stage?
Yeah.
Okay, okay. I just needed to be clear on that. Okay, guys. Let me take another question from I think it's still Jay Martins. No. Let me just see if I can take another. Jay Martins has other questions. I was just taking his own questions because he has numbered them and it's more orderly. But let me see if I can get it from that's
Okay.
it. So Amate Felix Brandon Elime is saying, is asking that.
Can you clearly make the difference between the cure and treatment for the audience, and also how the antiretrovirals work for those on these medications? At the moment, HIV doesn't have a cure. Like cure means
So
that.
let's be clear on that.
Yes, let's be clear. It doesn't have a cure, to the best of my knowledge, scientifically. Let me not say it, let the maybe pastors or people that you say that.
Otherwise, it could be. But medically,
yes, so scientifically, yes, or medically, there is no cure for HIV. And then for the treatment, which is the antiretrovirals help to stop the multiplication of the virus. Okay, it helps to stop I will call it the replication. It's just called the multiplication. That because once the virus enters, it starts making copies of itself, and as it's making copies, it's entering and destroying all of those CD4 cells that I was talking about. Okay, so what happens is that antiretroviral goes and stops the replication or the multiplication.
Further production, yeah. When I open our ears, they listen. When I open our ear, they listen. Like, guys, share the video, okay? Share, and pump hearts for doctor. Pump her hearts, encourage her. She's going to connect again. The internet is messing us up, but hey, we will get this show by fire, by force. We will. Okay, I see you all. Important topic like this, fans won't follow up. And I'm telling you, if na hide my ID Kongosa, come and see views. Are you telling me I'm fond of this on this platform? I need bother again. Like, you know what? Now your health is not my health. You want to come on here and learn, come on here and learn. You don't want to be my guest. Go and be following the things that will help you.
Sorry.
So people will have to
So as
choose
I
this
was
time
saying,
around. Yes, Doc,
okay,
welcome back. Yeah.
okay. So as I was saying, it stops the replication of this virus, and as it stops the replication of the virus, the viral load starts dropping because it's no longer multiplying
Yes.
as it was when you were not taking treatment. Okay,
Right.
so as the viral load starts reducing, it reduces to a level that is not detectable, but that doesn't mean that it is absent in blood, because we cannot say that, because if it was absent, then we can say that's a cure. But it's not yet. Scientists say that it doesn't make it absent. It just makes it undetectable in blood. The same way as you can see somebody has malaria, you go, they tell you that the test is negative. But as per your symptoms, I give you treatment for malaria and you come back and you're fine. So sometimes, so HIV, it's like that. It becomes undetectable, but that doesn't mean you don't have it. You're still HIV positive, but the viral load has just become undetectable in blood.
Right. Thank you so much for that. Next question on the screen already. Let me.
Exposed rapid HIV strip yield faulty results. What do you mean by exposed? Like you can have an HIV strip that you have blood on it and then you expose it. I don't know. Or can somebody who has been exposed? Anyway, yes, there have been cases where you have some faulty HIV strips. I wouldn't deny that. That's like one of the instances of medical errors, because you could have. That's why we tell you do your test in an accredited laboratory, because most of those laboratories, they always do a quality control for their strips before they start using it. That's why it's
Right.
important that you do your test in a very standard quality laboratory or hospital, because sometimes you can have some strips that are faulty, or they are expired, or they're not testing well, or sometimes it could be positive, it's showing negative, or it could be negative, it's showing positive. So yes, there have been instances of faulty results. And if you doubt your results, you have the right to seek a second opinion as a patient. If you do it in a hospital and you're not sure about the hospital, you can do it in another hospital or a standard laboratory to actually be sure what it is. Another instance is it could be negative. Meanwhile, you're positive because it's in the incubation period we're talking about. So you have to repeat the test after a certain period. It could be 1 to 3 months. Okay. So if you test it today and it's negative and you're really not sure, maybe you had sex with somebody who is HIV positive and you think that you may have contracted.
Right, guys, keep dropping your questions. Jay Martins, if you're there and you can hear me, please can you send your question again? Because I've tried to scroll up and they say I don't comment. I didn't see your comments. I think there was a comment. There was a question that was really interesting. I wanted us to talk on.
When it's undetectable, does it mean the test strip can go to negative, Doc? No. Most times, no, it won't go to negative. That's what I was saying. That undetectable doesn't mean that it's absent from blood. Okay, that's why it's good that you shouldn't stop your treatment. Continue taking your treatment. Continue taking your treatment, because there are different types of tests. The test strips, you have test strips that test for the antibodies. Okay, because when you're infected with something, when you're infected with HIV, your body, your immune system produces some substances to fight that infection. That is called antibodies. So when your body produces those antibodies to HIV positive, there are some strips that detect those antibodies. But there's also a test that determines the virus. That's the PCR, that actually looks into your blood to check if the virus is actually there. That's why they tell you, even with your test strip, they go on to do the PCR to actually detect the quantity of the viral load and the other things. So it depends on the test that you're doing. Are you doing just the antigen test or you're doing the antibody test? So it depends on the test. That's why it's really important that you go to somewhere, a quality hospital or a quality laboratory, where they're going to tell you that, okay, this is the difference, this is what is available, and this is the interpretation of the results you have.
Cool. There's one on your screen. I don't know if that's.
I heard someone with HIV can live up to 75 plus if they follow instructions. Why not 100 plus? You will live a normal life. That's why we tell people it's not a death sentence. You will live a normal life. It's just that people don't walk around with it on their faces. You will see someone as fine as, and you will not imagine. Okay, there are people who know how to take care of it. That's why I told you the two go hand in hand. Your drugs and then your lifestyle. Okay, you eat well, you exercise, you hydrate, you take a lot of water, you quit alcohol and smoking and all of those things. You live a healthy life, you take your medications, you go for your follow-up, you will be fine. It's not a death sentence. You can live 75, you can live to 100, you can live to whatever age you want to live, except that you have an accident, or which is if you die in an accident, it's not the HIV that killed you, it's an accident. So you can live to whatever age you want to live to.
Okay. That's a question on the
If a
screen.
mother,
some of you are just joining. I'm seeing your questions, and she already answered the questions. Okay. Yes,
so,
Doc, go ahead. So if you're joining, you
if
want
a
to
mother,
catch up again on the video, okay?
okay,
Because it's a lot of things that she has mentioned already. And I see some of your questions reoccurring again, but she's mentioned all of that again. But anyways, like I said, this is it's a good thing. You can still watch this video. It's going to be here and on YouTube as well. So just check this platform and watch it again. But again, she will have subsequent episodes where she would come and take questions, but it's topical. So today is on STDs, so you can ask any question regarding STDs. It could be on any other topic, but we would decide. She is the doctor, so she would decide the topics as she comes in. I'm just here to relay your questions to her. So that's it. Next question, Doc. Sorry.
Okay, let me just answer one question somebody asked on the platform before. The question that actually inspired me to choose this topic. The person was asking about recurrent chlamydia infection. The person said she's been diagnosed with recurrent chlamydia infection and she's looking for traditional treatment. So I just want to say something about recurrent STDs. If you're having recurrent STDs, there are 5 things you should check. First, who is diagnosing the STDs? What tests have they done? Because there are tests that if you do chlamydia today and you take treatment, let me say your treatment finishes today, tomorrow you go to do it, it will still be positive. But that doesn't mean that you have not been treated, okay? So you have to first of all check the mode of diagnosis. Who has diagnosed you to be recurrent? Because you can be taking treatment and then you're immediately going to do a retest. So you have to ask your doctor how many months or weeks after your treatment that you're supposed to do a retest to actually show that you are infected or not. Secondly, is the quality of the treatment you are receiving. Is the quality of the treatment, is it the right treatment? Is it the right dosing? And then the quality of the medications. Because people just go about buying drugs from drugstores, it doesn't work. Your test, the symptoms are not going away, and you say that modern medicine has failed. No, sometimes you have to also check the quality of the drug you're taking. And then you also have to check your past medical history. There are people who have other associated conditions that it could be making it difficult for your body to clear the infection, the chlamydia infection, okay? So you could have maybe HIV, you could have an associated infection that is reducing your immune system and is making it difficult for your body to clear the infection. Also, you have people who have been taking antibiotics over and over in such a way that your body has become resistant to antibiotics. So the antibiotics they're giving you now for the chlamydia is no longer working. But that's not of the doctor's making. It's because you have been taking antibiotics before without prescription. So your body has become resistant to the antibiotics when they need it. That's why I tell people, don't just go about, you have the least infection, you start taking ciprofloxacin, you start taking azithromycin, metronidazole. Because the time you actually need those medications, they will no longer work because you have been taking them for infections that are not there. Okay, so stop abusing antibiotics so that when you actually have need for those antibiotics, it will work the way it's supposed to work. Then the third thing I want you to look at is if you are being recontaminated, okay, because you can be taking treatment and let's say your partner is also infected, and you're taking treatment and you go and have sex with your partner, and your partner has chlamydia, it means that your partner is continuously recontaminating you if your partner doesn't go for his or her own testing. Okay, so you have to also check if there is any form of recontamination from your partner, or from anywhere else. Okay. And then the last thing I want to check is the retesting time. As I was saying before, the retesting time is if you've already taken your treatment, after how long are you retesting? And if you're retesting after the appropriate time, that's if your doctor is giving you the appropriate to be tested, and you're retesting and it's showing that it's negative or it's positive, then I'll advise that you maybe go and do a blood culture and the sensitivity so that it actually shows you what tests you should use, what antibiotics you should take.
Okay, Doc. Thank you. You just keep on, because I'm just going to be projecting the comments on there. Okay, just so that Okay. So you just take the one. Are you done with the question on the screen?
No.
Because I went off screen.
If a mother with hepatitis B gives birth and they don't inject the child with a precaution injection and give 1 week before administering it, can it affect the child? It depends on which precaution injection you're talking about. Is it because if a mother is infected with hepatitis B and is infected during pregnancy, there's an injection, that's the hepatitis immunoglobulin. It's supposed to be given immediately after birth, or they usually give a time of 72 hours that you should give the baby to actually reduce the chances. So if you give it in a period of 1 week, I wouldn't say the child is going to be infected, but it's going to increase the risk of the child having the hepatitis. Okay, it's not absolute. It's not like if they skip the 72 hours, the child is going to have it. No, it's just because they're given that time immediately after birth so that it should reduce the risk. It should reduce the risk of the child having it. So the more you waste time, the more you increase the child's risk of having it. But that doesn't mean that the child will eventually have the hepatitis. So they can give it after 1 week and the child will still not have it. The same way as they can give it after 1 week and the child will have it. Okay, so that injection immediately after birth is to reduce the child's risk or to reduce the child's chances of having the hepatitis. So somebody says, doctor, help me explain the difference between boosting and treatment, please. You spoke of boosting CD4 counts and treatment. It's the same thing, okay? The treatment helps to reduce the viral load, and as the viral load is reducing, the CD4 count is increasing. Because this is what happens when you're infected with HIV. When you have HIV, you have the virus, okay? The virus gets into your body and starts multiplying. So as it multiplies, it starts infecting or it starts destroying those CD4 cells. Now, when you start taking treatment, the treatment now helps to stop that multiplication. So as it stops the multiplication, the viral load starts dropping. And it means that if the viral load is dropping, it means that the amount of virus that is available to destroy those viruses is also dropping. And to destroy those CD4 cells is also dropping. So as the viral load is dropping, the CD4 count is increasing. So the treatment does the same thing at the same time. It reduces the viral load and increases the CD4 count.
Okay, Doc. It's a lot of questions coming in now. What are the precautions for hepatitis B?
7:20. I hope I can answer.
Sorry?
I have another meeting at 7:20.
Okay, you know what, guys? I understand. Okay, Doc. So how many minutes have you got? I don't tell you, say you have the day today. So let us know how many minutes more and you want to leave.
So we can say we can say to 7:25 so that I can use 5 minutes to catch my breath. Then I go for the other meeting at 7:30.
Okay, cool. I'm so sorry about this. Okay, so next time, because normally it's supposed to end at, we're supposed to have a 1 hour slot, right? Or is it 1 hour 30 minutes?
It's because of the the internet and everything.
I know, right? I know. It's okay. Just go ahead. Let's see if you can take that one. I don't want us to, you know what, for whoever has asked hepatitis B, it's a big topic and I want us to really talk on it. So this question will still feature next week. If doctor is available, we can come and next week and talk only on hepatitis B.
Right,
is that okay?
Right.
Okay, cool. Then let's take another question on HIV and then
HIV questions.
Let me see. There was a question on here. I don't know if I missed out on the question. Let's see. Guys, pump hearts for doctor now. When I watch, I need to pump hearts for doctor. What's wrong with you? All the art students, you people are jealous. I know, but today is for science. Your own Lawyer is coming any other time. I don't know if that question is very important, like that.
Okay. What is the difference between the antigen and the antibody test? Okay, so the antigen detects the HIV virus. Actually, it detects the HIV virus. The antibody detects the antibodies, and antibodies are the substances that the body produces in response to the HIV infection. Because your immune system is wonderful. When your body detects a foreign organism like the HIV, it starts producing those substances to fight against it. Okay, so those substances are called antibodies. So the antibody test actually detects the antibodies. So the difference is the antigen test is going to detect the disease very early than the antibodies. Okay, because the antibodies has to reach a certain level before it becomes detectable in blood or on the strip before it becomes positive on the strip. So the antigen will detect the disease very early. That's earlier than the antibody. So most times when you go to do the HIV test, they do two different types of tests to actually determine if you're positive or negative. That's why sometimes you go and do your test and they'll tell you it's indeterminate. One is positive, one is negative, and they cannot really tell. So they'll tell you to go and come back maybe in 1 month, in 2 months, 3 months, depending on the laboratory and whatever reagents they're using. So sometimes you go and they'll tell you indeterminate, and they'll tell you to come after a certain period of time to recheck again to know definitely if it's positive or negative.
Okay, Doc. There's a question on the screen.
How can a positive parent manage to have a negative baby? By taking your treatment. That's it. If you have an HIV positive patient, if you have an HIV positive patient, if you have an HIV positive mother and she takes her treatment very well in pregnancy, and then they take the necessary precautions during delivery. So there are particular precautions you take during labor and delivery to also reduce the chances of transmitting it to the child. So that's why it's advised that they always advise you that you should do your clinic, your antenatal clinic in a good hospital, and you should also prepare to deliver in a really good hospital. Because when a woman is HIV positive, we try to reduce the number of vaginal infections that you do. You try to reduce, there are a lot of precautions you take during labor and delivery to really reduce the chances of transmitting it to the baby. Okay, sometimes they even recommend that you go for a cesarean section because it's safer for the baby. But you can also deliver vaginally, but there are some precautions that they must take. And if you do that, you can have a negative baby.
Great. Okay, Doc.
So immediately there are drugs that they start giving the baby. Okay, there are drugs that start giving the baby right up to 6 weeks of treatment. Up to 6 weeks, then they'll retest the baby to see if the baby is positive or negative. So the baby will actually undergo, is a number of tests to actually follow up, and they'll give you a lot of counseling, whether you breastfeed, and you have to do exclusive breastfeeding, whether you're going all in for breast milk or you're going all in for artificial. So there are a lot of chances that they'll give you a number of options, and you're able to choose. And you can actually, as a positive mother, have a negative baby. You can. It's very possible.
Thank you so much, Doc. Last question on the screen, guys. We're going to take just this last question because Doctor has to leave. Okay.
Do all HIV positive clients qualify for treatment? So yes, the latest recommendation is test and treat. Immediately a patient is qualified for, because you have different things they do. You have different tests that they do before they put you on treatment. For example, you can have a patient that is testing positive and the patient is unstable. Let's say the patient is unconscious, or the patient is having a severe kidney disease, because those drugs are excreted by the kidney. So there are a number of tests that they'll do, or a number of checkups that they'll do to see if they can actually start you on treatment at that moment or not. But the recommendation,
because I think I've had a situation. A lady came on the platform and asked that, she's been tested, but they said she should wait or something, that she cannot start treatment immediately or something. I was blown apart, because I thought immediately you just have to boom and start taking, our own layman way of thinking.
Yes, that's
Well,
the recommendation. The recommendation is test and treat. Test if the patient is positive, you treat. But of course, they still have some protocol that you need to follow. They have a protocol that they have to follow, tests they have to do to actually qualify you that, okay, we're going to start now, or we're going to give some time and all of that. So there's a protocol they use to start before starting you on treatment.
I see. Thank you so much, Doctor. It's such an honor to have you. We've had it's beautiful start. Okay, we've had a very beautiful start, and I'm really happy that regardless of all the technical glitches, you could still stay there and we pull through. It's amazing now that you have a stable internet connection at the end of it. Now, it's a lot of questions that are still coming on, and so many people are still asking questions that had been asked at the beginning. So you want to watch this video again and get all of this. So Doctor, let us know, when are we having you next, and what's cooking?
Okay, then we'll just communicate. I'll check my program and then I'll let you know.
Okay.
But yes, most of the times when I see a medical question and I have the time, I usually answer. I'm sure most people are going to see Empty Jam Health when I answer that. And also you can follow the page. The page is Empty Jam Health on social media, on Facebook, on Instagram, More Than Just an MD.
Right. I'm gonna put that information tomorrow early in the morning so that people could also follow you on her own platform. Okay. So it's just she's just one of our followers who has decided to, be a blessing to you all based on the number of questions that are coming there. And like I always tell you people, I am no medical expert. Matter of fact, I'm nowhere close to it. That's why you've never seen me answering anything regarding medicals. All I can tell you is give your life to Jesus Christ. And then you can now, the doctors and you can help you. I'm always there for help now. But I just brought her on here just so that she can help out with all of this. And I hope that you people you've learned something today. Okay, I really hope so. And hopefully next week she can come out again. If not, then it's going to be only after 2 weeks. But that notwithstanding, like I said, I'll put her information on the platform. And then most of you can go on there and check out, ask her questions privately. She's going to answer you. The doctors are never tired, just like we counselors. We're always available to respond to all of your questions, okay? So thank you so much. Una palm hearts now. Palm hearts before you leave. Still share the video and still tag people, even at the end of it. And before you guys leave, please, there is a conference coming up in July, from 21st to the 24th of July. It's been organized by Dr. and Mrs. Ngafison, okay, and it's the Leeds Mission International. So it's under the umbrella of Leeds Mission International. So we have the Leeds Men Conference and the Leading Women Conference all together. So I will be one of the speakers. I've put it on my official page, but I'll still put it on this page. You guys, it's free for those of you in Africa. It's only a token for those of you out of Africa to register. So if you register, it's free. Just so that when it's about that time, you can follow all of the different awesome speakers who will be there. Okay, my mentor will be speaking, Eno Ayong will be speaking. Those are my mentors. Dr. Ngafison and wife will be speaking, and a lot of other very, very important persons will be speaking. I will be talking on something very, very important as well. So you want to tune in, be the first to register so that it doesn't get jam-packed, because sometimes it's jam-packed and you cannot have access to all of that. Okay, I will play the video just like now. You want to follow exactly what they're on about, and then get the details and register. Okay, thank you so much. It's been an awesome session. Do not leave. Share this video again. Watch this video that is coming next, and I'll see you again. Bye bye. I love you. Bye bye. Bisu bisu. Bye.
Hello, my name is Madison Ngafison,
and I'm Claudia Ngafison,
and we are the founders of Lead Missions International. We are so excited to announce to you our 2021 suite of conferences.
We all know how the last 12 months have been, but we believe that this is the time to arise and take the lead in our lives, families, communities, and the nations.
That is why we are inviting you to our Men Lead Conference holding July 21st and 22nd in Mission, Texas.
And our Leading Lady Conference on July the 23rd and 24th in Mission, Texas.
In our Men Lead Conference this year, we are exploring leadership above and beyond.
And for our ladies, we will be exploring the 3 V's: vision, values, and voice.
You know how the bar of leadership keeps dropping in our society today, but we believe that now is the time to arise and to go above and beyond and to set the stage for the right kind of leadership that we want in our families, in our communities, and in our nations.
Ladies, we shall be uncovering how to add a voice to our vision and values as we live out our true calling as leaders in society.
So why not join us July 21st through the 24th in Mission, Texas, and in person, or from the comfort of your home somewhere around the world.
This year we'll be coming to you from the Lead Missions headquarters in Mission, Texas, and we'll be broadcasting to the rest of the world.
Please watch this.
Hello and welcome to the beautiful city of Mission, Texas. My name is Obed Garza. I'm a pastor here at Freedom Life Church. And this is the auditorium where we're going to be hosting the 2021 Men Lead Conference and Leading Ladies Conference with Lead Missions International. Welcome. Here at Freedom Life Church, we're so excited to be hosting the 2021 Leading Ladies Conference and Men Lead Conference with Lead Missions International. If you're joining us live, click on the link below and get access to local hotel accommodations. I'm sure you're going to find something that suits you just right.
Wow. So, why not register now and take a front seat? Thank you.